welcome to Cefivba, the Center for Reproductive Medicine in Balears. We are located in Mallorca. Now we are with our medical director. This is Dr. Darder. Hello.
Hello.
Thank you very much for having us here. So Dr. Darder Bartolomé is one of the members of the team that in 1986 this center was the responsible, in English you say, responsible of the firstborn of a baby born after an IVF in Mallorca, in the Balearic, in this community. This team, yes, the responsible of this born of the baby, the first baby born here, yes, in Mallorca, were 7 people. Who were there?
We were 7 professionals.
Who were them?
We were 7 professionals of different specialities, and they were, may I say the name of each? So 2 gynecologists, yeah. Dr. Salva,
yes,
which unfortunately he died a few years ago,
yeah.
Myself, and also one andrologist, yes, Dr. Mariano Rosselló, still inactive.
Yeah.
Then 2 specialists in the IVF laboratory,
yeah,
is Dr. Calafell and Dr. Viader.
Yeah.
One psychologist is Susana Cañellas.
Yes.
One specialist in diagnosis of the
radiology,
radiologist, and very specialized in
ultrasound.
Ecography, ultrasound.
In ultrasound. Dr.
Juan Antonio Ferrer.
So
correct.
7 people, they decide to start doing IVF in the island, in Mallorca, and you learned from 2 sources, I would say, the UK and also Barcelona.
Barcelona.
You went to the UK to learn the technique, right? So where in the London, in the UK, where are you?
The reason I did go to United Kingdom is because I did all the gynae specialty in London.
Yeah.
For 5 years I did work there to do.
You became a gynecologist there in the UK, right?
In United Kingdom,
okay.
Yes. I have the chance to go to the Hammersmith Hospital.
Yeah, Hammersmith.
The professor at that time it was Robert, and then became Sir Robert Whiston.
Oh, so after that it was Sir?
Yes.
Yeah.
Because he was a pioneer in tubal surgery.
Oh yeah.
And then
fallopian tubes.
Yes.
Yeah.
All the experts in fallopian tube surgery then passed to the IVF
All right. So it was a natural procedure, a natural step forward.
Also, I did. So in my beginning, I did also
surgery,
tubal surgery.
Yes. Microsurgery. To repair.
That's right.
And then after that, it started to do the IVF, so it wasn't necessary.
So I have the contact with Bob Whiston, and in Barcelona, my friend Pedro Barri, see. Then we have all this training with them, and also the biologists and so on. They also have the opportunity to go to Barcelona to do the training.
So we are talking here about, I would say, the same level of Patrick Steptoe or Robert Edwards. So you are also pioneers here in Spain. Pedro Barri was the manager with Ana Veiga, okay? In the Dexeus in Barcelona, they were the responsible. They were there were the first IVF that succeed in Spain, and the second, I would say, the second community here in Spain was you in Mallorca. I would like to notice that the connection between the UK and Mallorca is not only because of the holidays or beaches or whatever. It's also a connection with medicine. Doctors from here going there, no? So the stimulation of the cycle. How did you do it? How did you do the stimulation?
At that time, we did the stimulation exactly how we do now with hormones.
Yeah.
Special hormone.
Injections.
Injections. That's right. Yes, gonadotropin is female hormones.
Yeah.
Okay. And we stimulate
FSH and LH.
Yes.
Yeah.
That's it. and we did the stimulation of that. We controlled by the ultrasounds.
Yeah. And the ultrasound was vaginally, no? Or the
no,
ultrasounds
no,
were
no,
abdominal?
Abdominal.
So
abdominal.
you didn't have
yes, no, no,
the probes vaginally?
No, no, no.
Right.
No, because then it came after, and then to puncture the ovaries
to do the pickup,
to retrieve
the eggs,
to retrieve the eggs by the help with the ultrasound.
Yeah.
That it came after.
Yeah.
At the beginning,
yeah.
We have to use to retrieve the eggs. We have to do by laparoscopy.
Laparoscopy. Okay.
That means pass a tube through the
yeah.
abdomen,
yeah.
and another puncture to pick the ovary and the follicles and aspirate the follicles with the help of the laparoscopy.
Yeah, but the laparoscopy was, you didn't have either a cam, a monitor or whatever. It was directly looking through the lens, so the lenses in English, so the lenses.
Yes.
And then you do it with the needle, you pick up, and there was.
That's right.
And you with the pedal, you have a machine.
A pedal
with a pedal to aspirate the follicle.
Correct.
Okay, liquid inside, and there was one of your team or your colleagues.
Yes.
Check
the test tube where the follicular liquid goes on there, and he was telling me, because I was bending my back and looking straight on without the help of monitor.
Any monitor or whatever. And you
we are before
you realized that you were making history in that moment?
I did realize what?
That you were making history of the medicine?
Well,
you were aware that it was history, you were making something new and very special?
Well, we were aware that we started from nothing. We did not have law.
Yeah, no Spanish law, which is quite a very advanced
the
law.
It came afterwards.
In 1888. So the first law that we have in medicine, reproductive medicine in space was 1988, and we're talking here about 1985.
That's right.
Okay, it's quite impressive. Okay, that but you didn't know that it will work. Maybe we are talking here about a field in the medicine that we could be speaking in other ways. Imagine that it failed and no one. You were okay.
Well, the director of the hospital where we did work, I was telling him, be patient. Perhaps we'll take 1 year till we'll get the first pregnancy. Oh, okay. In the first try of six
transfers.
Six tries, six cycles.
Yeah.
On the first set of 5 cycles, we did get the
quite soon, I would say.
Yes.
I mean, it wasn't 100 or whatever. It was 6.
Yeah.
Okay, so it's and then the thing is that you can only fertilize 3 eggs. Why? Why only 3? Not imagine that a lady, you retrieve 10 eggs, but you could only work with 3. Why?
Yes, because we could not freeze the embryos. You see, all the embryos we did get, we had to transfer. We have to put inside the uterus. So we couldn't inseminate only 3, and if all 3 get inseminated, all 3 eggs gets inseminated, then we'll have to put all 3.
Because the freezing procedure didn't exist.
No.
So the thing is,
posterior.
It wasn't a legal question or a technique question. It wasn't that the freezing procedure wasn't invented already.
Yes.
It doesn't exist. It didn't exist at that time. So it's very interesting how the history of the medicine, of the reproductive medicines has changed. So I think we have now the new generations that we are working in this field, we have it very easy. We have very, very precise gonadotropin. We have vaginal ultrasounds. No matter you're working here or whatever, maybe I would say all the gynecologists in the world, they have very, very, very high resolution ultrasounds, machines. We have very, very thin needles. We have propofol and procedures to make the lady sleep up, almost don't feel anything in the procedure. And the transfer, how was the transfer? It was very different,
no,
much more different
the transfer was quite similar. I think we use a catheter, a fine tube to pass through the cervix. We pushed inside the uterus. Exactly the same we do here. The only thing, we did not have the help of the ultrasound at that time.
Again, nothing, no ultrasound.
We have to take in mind only the centimeters of the catheter and pass in order to calculate, to put the culture liquid with the embryo more or less in the upper part of the uterine cavity.
The uterus, not the tummy or the inside. But when you were doing the stimulation of the lady with the gonadotropins, did you do scans?
Yes.
To see it was abdominal, right?
Yes, because we stimulate the ovaries, so by the ultrasound, we check the response of the ovaries to this stimulation, and we do as we do here. Also, we count how many eggs, how many follicles, follicles the ovary produced. You see, we do that. But we do abdominally. The ultrasound was through the abdomen, because in that moment we didn't have the help of the vaginal.
I think it has developed a lot, okay? And you are one of the pioneers here in the world, I would say. And it's very, very, how you say in English, conmovedor, thrilling maybe, how you say?
Satisfying.
It's satisfying and very, I would say, emocionante. No, it's very, very emotional for us. And thank you very much, Dr. Darder, for being one of the pioneers. And here in this center, Cefivba, the Center for, I would say in English is Center for In Vitro Fertilisation of Balears, okay? That we are still working. So it was the pioneers, but we are in the hospital Palma Planas, one of the leaders of the medicine here in the island, with many people coming from Europe also here. And thank you very much for having us, and we continue explaining you history and many things about IVF and reproductive techniques. Thank you very much.
You're very welcome.
Bye bye.